Is it better now? Can you hear me now? Can you hear me now? I didn't realize that. I might have to repeat. Can you hear me now? Okay, Kenneth, thank you for that. Winston-Salem, North Carolina. Anyway, so Lori, the main thing you need to understand is that the goal is for you to have patient provider shared decision making. So let them know that they are not able to get your pain under control with just the oral. All right, Kelly, how do I respond to a doctor when they say opioids make pain worse? You say, I understand that has been the experience in some people. I find that the pain medicine makes my pain better. I have radiographic reasons for pain. That's not the issue. They're just trying to keep you from getting your pain medicine. And you have painful conditions. Again, if that was the issue, then we would already be done talking. Can't wait to read your book. Thank you for that. By the way, the book is called You Are More, Advocating Your Care in a System That Doesn't. It can be most easily found at a certain location. So if you have ever wondered what it takes to support your own clinical advocacy, go here and you have lots of tools. But the number one tool is the book, You Are More. And you can buy it right there at the TikTok shop, at drmikesays.com. You can also buy it on Amazon. But you have to search my last name, which will be in the description. Anyway, Kelly, back to you. When a doctor says that your opioids are making your pain worse, they are effectively gaslighting you. And my answer to you is don't entertain it. Just say, the pain medicine works for me. I'm not asking for more than is reasonable. Whatever you do, don't allow yourself to be on the defensive. Okay, just don't. Thank you for the like. I appreciate that. Don't allow yourself to be on the defensive because you're probably not going to change a gaslighter's mind. Remember, the book does not help you win over assholes. The book lets you know when you're dealing with an asshole and tells you to move on. Okay? All too often. Now, Keely has another question. Keely was recently let go from her job because it's on pain meds. He said Keely didn't specify male or female. So they said, I do not take them at work since I drive to work. This was just a random test. Is this legal? I have a med list from my pharmacy that show what was in my system that I'm prescribed. And so now the pain clinic put me on probation because of getting let go by my employer. First of all, that's an inappropriate response from the pain clinic. Okay? However, you may be stuck at the moment. So you may have to deal with the probation. But the best way that you can deal with probation is to not get defensive about that either. Don't get defensive. They're wrong, but don't get defensive. Can I say that again? They're wrong, but don't get defensive because it's not going to do you any good at the end of the day. And at the end, and what is this really all about? It's about accomplishing all that we're trying to get through our healthcare. Okay, now, your employer releasing you, that's a little more iffy. I think I would seek legal counsel. I would. I can't give you legal counsel because I'm a medical provider, but I would seek legal counsel because I don't think they have a leg to stand on. I think that the Disability Act covers you if you're taking your prescribed medications at work. I'm not a lawyer. Wherever the camera is, I'm not a lawyer. Don't believe me, but get legal counsel. All right, now, your pain clinic putting you on probation was not appropriate, but again, sometimes you just have to deal with what you have to deal with, okay? You're not in the wrong. Can I say that, Kelly? No, this is Keely, sorry. Can I say that, Keely? You're not in the wrong. This is one of those times when being in the right doesn't necessarily get you all the way home, though, okay? So just because you're not in the wrong doesn't mean it's going to go your way. Okay? It means that we have to, what's the word I'm looking for? It means that, to be honest with you, when you have to be the most careful is when you're right. When you are advocating for yourself and you know that you have right on your side, the number one thing that you have to do is not be too much of an asshole about it. You simply, here is the number one remedy when talking to doctors. Ask everything in a way that is curious. It just doesn't seem right that you would put me on probation because they found my pain medicine that you prescribed me in my system. That doesn't seem right. Can you explain to me again why I need to be on probation? Again, see how that sounds? I promise you this, you're still making your point. Keely, I'm praying for you. That's a rough situation. And I think that that's, wrong on so many levels. Jennifer, it's your turn. Jennifer says, I got your book today, and I love it. All right, and we know what book we're talking about, okay? I'm telling you, this is changing healthcare one conversation at a time. Go to a certain place. Now listen, while you're going to a certain place, can I go ahead and tell you here, I have people who need books donated, okay, who can't afford the book. And a donated book costs about $14. And I would really appreciate anybody that goes to drmikesays.com and buys a book for someone else. I got about 20 people waiting on books right now and would appreciate that. And I give you a discount because you're being nice to someone else. Also, if you want to buy a book for a provider, that's nearly the cheapest that there is. It costs literally $10 plus shipping to buy a book for a provider. And there's a lot of providers out here who need to know how to love you. The purpose of buying this book for providers is to teach them indirectly how to love you better. Now, let's go back to Jennifer. Jennifer says, I want to ask how to speak with my doctor about Amy. Good to have you on here. Okay, my lower numbers are 100 to 90, and I've been trying so hard to lower it through my other doctor, and nothing is really helping. Is this normal? Amy, the first thing I would do is get a sleep study. You probably need a sleep study. The number one reason for refractory high blood pressure is that no matter how much medicine we put you on, is undiagnosed sleep apnea. So that's the first thing I would do. The second thing I would do is I would get a note from my doctor explaining what the plan is. Okay? So I'm assuming your pain doctor is harassing you about your BP. Now, I would get a note from my blood pressure doctor explaining that you are adherent to your plan and that there is a plan for the future too. Just a very quick summary note. Hand deliver it. That's what I would do. Now back to Jennifer. Okay. I want to talk to my doctor about adding a full agonist opioid on top of my Subutex. I have done so before for acute pain with good success, but I don't know how to address it with my doc since I have previous opioid use disorder. 8 years in recovery now, tomorrow. Fantastic. First of all, let's hear about 8 years of recovery. That's fantastic. Okay, so Jennifer, completely excited about that. Now, how do you talk to your doctor about it? You begin by just having a pure conversation. I need you to know that my current plan is not adequate at times. I would like to try some short acting. I'm open to whatever you suggest. The number one thing, Jennifer, is that when you're making your case, two things. And by the way, this is a chapter called Don't Tell Them What You Want, beginning on page, in the current edition, beginning on page 73, I think. But let me double check. 73. Don't tell them what you want. Okay? So, what I'm saying to you is, I would bring up, when I have acute pain, a little bit of short acting on top of it really does help. I might ask, again, what you're trying to do is get an incremental change, Jennifer. So I would ask, is there any way we can consider that? I know about my opioid use disorder, and I would lead like this. And I'm going to trust you to let me know if things are problematic. Okay? I think that I've come far enough that I believe I can follow the rules, but I need your feedback. Is there any, and again, Jennifer, when you're asking the question, sound curious. I just wonder what a plan like that might look like, and if you feel like we could manage it together. That word together is very intentional and important, okay? Now, if he says no, leave it alone for 3 months. But here's what would be the most successful. If you went into there cold and you came out with 15 short-acting tablets to use on bad days, call that a win. Call that a win. And then don't abuse the 15. What I mean by that is go back on future months and say, I used it here. I used it here. Write down when you use it. Give the doctor kind of a list of what the circumstances were. It shows your awareness of their concern. When the more you show your awareness, this is for everybody, for all patients, the more you show your personal awareness of your provider's concern, the greater that communication is going to be. Okay? The more you're going to win. And again, win is what is win in chronic pain management? Win is shared decision making. It doesn't mean you get what you want. It means you are heard. That's the win. Okay? Now, again though, Jennifer, great job. And that, the most important thing is it's shared decision making. So as long as you leave there feeling like my provider listened to me, there's no red flags, you're probably not going to get an immediate win. This should be probably 2 or 3 visit win, not an immediate win. Matter of fact, to the greater degree, on the first visit that you bring it up, you'd say, I would just like to talk about things in theory, the more it's going to ultimately go your way. You see that again? To the greater degree that you're able to say, I want to just talk about this in theory, the more ultimately it will go your way. One more question today. First of all, I've had some really good participation. A lot of people coming in, a lot of people staying, a couple likes. Thank you for that. This is the first time I've tried it. I'm not good at it. Y'all had to tell me to turn on the microphone. That's ought to be evidence that I ain't very good at it. Okay? But love y'all deeply, no buts. Those of you that never met me before, you'll understand that in the future. Loretta says, due to a back order of my long-acting pain meds, I'm going to run out of my short-acting meds this month, early this month. Where is a safe place to get Kratom online? First of all, let me just say that the answer to that question is www.new, the word new, the word hope, and the word botanicals all together. That was plural, botanicals. Okay? newhopebotanicals.com. That's Jordan's site, and he has done wonders for me. He's taught me a lot about Kratom. He has great product. I don't think you need to worry about anything you would buy from him, okay? And so that's how I would handle it. However, I'm going to give you some unsolicited advice, Loretta, and the unsolicited advice is it's reasonable that you're using your extra short acting. You just need to do that in conjunction with your provider. I would be reaching out and saying, I can't get my long acting. Give me directions on my short acting, knowing you've already been doing your own. Okay, but that's okay. You don't have to be forthcoming with that yet. Okay, but the more you can be forthcoming with your provider about what is going on, the greater you're going to get buy-in to whatever plan you come up with. All right, hang on a second. Yes, I know. You were probably Frank, you're spot on. Those are very good points. You're not, I don't disagree with you one bit on that. And again, I love that taking you at your word. That's the win. When you have great communication between you and your provider, the win is the shared decision making. It's not that you can get everything your way. Now, that's awesome too. I have a suspicion though that Amy is dealing with a little something different. Amen. Let's hear for the unicorns. I appreciate you contributing, Frank. This is the first time I've done live on this account. So thank you for that. Anyway, back to Loretta. To the greater degree that you can be open and consistently upfront, the more you're going to get shared decision making. Amen. Okay. There you go. And you know what? That 90's not forever, Frank. Honestly, I believe the pendulum is going to begin to swing in probably the end of this year, the beginning of next year. I think the pendulum is going to swing a little bit, and you're going to see more people that are on some doses higher than 90. It is true that before the 2016 guidelines, there were some people that were on stupid high levels of medication. And we did the entire wrong thing to address the minority. We hurt the majority, and that was wrong. Okay, so those were the questions I had to answer today. I do appreciate the extra attendance, extra participation. Would appreciate if you would let other people know that this content has arrived to YouTube, because I'm a TikToker by nature. Dr. Mike Says on TikTok as well. But I am on a month-long sabbatical from TikTok and trying to emphasize and grow this content here. So make sure you're hitting the subscribe button. Make sure you're hitting the likes. Make sure you're adding your comments. Send me questions either here or go to drmikesays.com and you can send me questions there. You can buy this book at drmikesays.com or on Amazon. And I love y'all, no buts. When you know a little bit more about my content, you'll know what that means too. Bye.